Thank you everyone for joining today's webinar. My name is Dana Zemak and I'm the Manager of Programs at the Schlegel-UW Research Institute for Aging. Before we begin, I just wanted to let you know that we are planning to have about 15 minutes at the end of the presentation for a question and answer session. So if you do have questions, you can add them to the Q&A box that's at the bottom of your screen. If you add them there, I will monitor them throughout the presentation, and then I can share those with Laura as we wrap up her presentation time. And then at the end of the Q&A session, we will also have a very brief 5-question survey that we would love for you to complete. But if you are not able to stay until the very end, I'll also send a follow-up email with a link to the webinar recording as well as the survey. So we would love for you to fill that out for us. And now I would like to introduce Laura Middleton. She's the Associate Professor in Kinesiology and Health Sciences at the University of Waterloo and the Schlegel Research Chair in Dementia and Active Living. Laura's research aims to identify strategies to promote well-being and independence of those living with or at risk for dementia. She involves people living with dementia, care partners, healthcare professionals, and community service providers as co-researchers to create accessible and effective supports and interventions. So thanks for joining us today, Laura. I will hand it over to you.
Excellent. Thank you so much, Dana, for introducing me. And thank you all for coming to this presentation today, taking time out of your lunch or maybe while you're eating your lunch to be here. I look forward to sharing the new Dementia Wellness website with you, which is a product of both the Dementia Inclusive Choices for Exercise project, or DICE, as well as the Dementia Resources for Eating, Activity, and Meaningful Inclusion, or DREAM projects. I'll talk a little bit about the rationale for these projects and why you should care about using these, and I'll talk about how the toolkits were developed, as well as how you might be able to use them, whether your practice is in the community, in a healthcare setting, or in long-term care. I think these can be useful training, learning modules, and resources regardless of your setting, and indeed, academic institutions as well. But before I get started, I would like to acknowledge that I am presenting on behalf of a large project team that include diverse members. As Dana mentioned, in our work, we engage people living with dementia and care partners, community and dementia service providers, physical activity providers, dietitians and nutrition experts, healthcare providers, as well as researchers in our project teams working together as equal partners in these initiatives. So it's evidence informed, but the voices of all these different groups are acknowledged. Within the teams, we also had people from a variety of different institutions shown here. As you can see, there's healthcare providers, there are academic institutions, and there's also a lot of community organizations that are represented in our groups. Finally, as I get started, I'd like to acknowledge that I'm a settler that lives and works on the traditional territory of the neutral Anishinaabe and Haudenosaunee people. I honor their stewardship of this land and keep their stewardship and their values in mind in all my work. This land is also part of the Haldimand Tract, which is shown here, land on 6 miles on either side of the Grand River, granted to the Six Nations of the Grand River within the Haldimand Treaty of 1784. I'll note that of the 750,000 acres that were set aside within the Haldimand Tract, less than 50,000 acres remain, that's shown in yellow, due to a series of agreements often entered into dishonestly and rarely adhered to. Further, these lands cover only a small portion of the land and the vast territories that these Indigenous people lived in and roamed. Now, when I give talks about dementia, I often start with the inspiration for my research. My Aunt Eileen, who's shown here, was diagnosed with early onset dementia at the age of 46. At the time of her diagnosis, my young cousins, blurred out here, were only 12, 14, and 16 years old. She was my mom's best friend. In the early stages of her diagnosis, she continued to walk the trails shown in this photo next to her, and nature remained a meaningful part of her life. She continued to take classes early on in her diagnosis to keep busy, yet even with all this determination, stigma of dementia kept her from disclosing her diagnosis, even to her neighbors and others close to her, people who could have supported her to have a better life day to day with dementia. So it's with this in mind that my research aims to improve the lived experience of people living with dementia. I also wanted to acknowledge the many people living with dementia who I've been lucky to learn from through my research, and I could show a number of care partners as well on here, but are not currently listed. This is just a handful of the people I've got to listen to. Their words and actions have deeply influenced my thoughts, perspectives, and work related to dementia. Of course, I'm not the only one here who knows about or knows one or more people with dementia. Indeed, the landmark study was released a couple years ago by the Alzheimer Society of Canada. The study suggested that there were about 600,000 people living with dementia at the time of its release, and that number is expected to more than double over the next 30 years, so that by 2050, there will be over 1.5 million people living with dementia in Canada. I don't say this as a forewarning of disaster, but as an impetus to start preparations to better support life of people living with dementia, to create communities, programs, and services that understand dementia and support people living with dementia, to create a healthcare system that doesn't just diagnose and ask people to prepare for the end of life, but that offers support and care and services that help people with dementia to live to the best of their abilities. And so I'll start with one of the outputs from the Dice and Dream projects, a video. We often underestimate the ability of people living with dementia to live well, likely because dementia isn't visible until the latter stages, until changes have progressed. Here, I'd just like to take a few minutes to hear the perspectives of a few people living with dementia and family members regarding their perspectives on living well with dementia.
When I was diagnosed with Alzheimer's,
Sorry about that, everyone.
when I was diagnosed with Alzheimer's, I kind of didn't believe it. As my mother had Alzheimer's, and she didn't handle it very well.
Well, you have to get over the fact that you got it first. Because you can't just sit in a chair and sob your whole rest of your life, you know? You have to get out and do what you can do.
If one was diagnosed with dementia, whatever, you need to ask for help. To let people know what their situation is, not to hide it.
I decided my best idea was to tell people about it. And then if they saw me doing something weird, they could help me, or at least they would be aware of why I was doing it.
The advice that I would give to somebody newly diagnosed with dementia and their care partner is to find out as much as you can about dementia. There are lots of organizations that can be involved.
You're not necessarily getting better, but you're handling it. You learn how to handle it. So that's the important part, as far as I'm concerned.
I would advise anybody who is a care partner for somebody with Alzheimer's to go to a support group. It just made it so much easier for me to cope.
In an exercise program, the main thing I think would be to have someone there to help them, to assist them, to encourage them. Yes, you can do it. Yes, you can do one more.
I think exercise and eating healthy is the thing that I have to do all the time, and, you know, not let it slip.
Keeping busy. That's the one thing the doctor said to me. Get out and get busy. And other people can help you do that. Lots of people have ideas of things that you can do if you just talk to them.
I think one of the things that I want to stress, for whether it's me going down this journey with Dad, whether it be anybody else going down this journey with their family member, parent, brother, sister, whoever it may be patient. Be patient not only with the person undergoing the change, because it's scary, be patient with yourself too, right? And that's the biggest thing I think I've learned, is not to be so hard on myself. My biggest motto is always try to find that silver lining, and it won't be so bad.
So I think one thing that resonates to me when we listen to the voices of people with dementia and their family members is that the support of others, yes, the family members themselves, but also other community members and service providers, have a profound impact on the ability to live well with dementia. So that leads us to think, and the rationale behind Dyson Dream is, what can we actually do to support them? Indeed, before I move on, I will also want to highlight the words of Roger Marple. He was a passionate advocate for people with dementia and for research. He passed away 2 years ago, but his words and his friendship stay with me. At a 2019 talk to a room full of people with dementia and care partners, he said, "What if we started with hope? The learning process for dementia needs to include hope for living well and practical ways to achieve this. This should be taught first. If we can each take it upon ourselves to take positive actions to support and include people living with dementia in our programs, services, and to support them, their health and well-being, then their hope for living well will have transformed into a reality." Looking into the research evidence, we can also identify strategies that are important to living well with dementia. A study run out of University of Exeter in the UK, whose aim was to understand the characteristics that promote living well with dementia, conducted many independent research summaries, but they simplified their results down to 4 different actions that we can take to promote living well. First, promote physical fitness and physical activity, as well as broad participation. Increase participation in their communities and reduce isolation of people living with dementia. Enable people living with dementia to manage their daily activities and as independently as possible, and provide positive social and emotional support. Optimistically, through inclusive and supportive wellness programs, we can improve all 4 elements of supporting living well with dementia. The focus of the DICE and DREAM projects that I will introduce here is on exercise, physical activity, healthy eating, and meal times, and how we can support people living with dementia in those programs. But why focus on these elements? Well, people who take up physical activity in clinical trials show improved strength, improved balance and mobility, improved cognitive abilities, and improved fitness. Likely as a result, people living with dementia who take up exercise also show better independence in their ability to manage day-to-day activities. What's interesting is that care partners of the people living with dementia who exercise, regardless of whether they're active or not, have reduced stress associated with caregiving. Similarly, people with dementia who eat healthier have improved energy levels, better mood and well-being, improved health and immunity, and healthier bone mass and muscle mass, which may also translate into improved ability to maintain daily function and health despite dementia. Now, those are what we study well in clinical trials. But when we think of the benefits of supportive groups in the community, there are additional benefits that can be experienced. In fact, when I talk to people living with dementia, they often describe the social benefits of programming first. When they participate in community wellness programs, they feel a sense of community. They develop relationships and friendships that are important to them. They're encouraged by their peers and by the activity leaders. It can help to improve mental well-being, confidence, and support their identity independent of dementia. Unfortunately, people living with dementia are often still excluded from healthcare and community programs and services due to stigma of dementia, an assumption that people with dementia won't benefit or aren't worth supporting. But we need to change this mindset. People living with dementia have the right to be included. The UN Convention on the Rights of Persons with Disabilities, or the UN CRPD, supports the rights of persons with disability to full participation and inclusion in our communities and societies. This includes people living with dementia. I was introduced to this human rights mindset about 10 years ago by Mary Beth Whiten, shown here, a very impactful Canadian dementia advocate. To promote empowerment and inclusion, this access must be ensured, and it's important that reasonable accommodations are provided. Specifically, the UN CRPD supports equitable access to supports for health, habilitation and rehabilitation, and participation in cultural life, recreation, leisure, and sport, which are all directly relevant to physical activity, healthy eating, and mealtime programs and services. Measures to support health and rehabilitation should begin as early as possible after a diagnosis, be provided in locations that are convenient for each individual, often close to where they live. So we can't just rely on a few specialty centers. To achieve this access to programming, it's important to train professionals and staff and equip them with the tools necessary to support inclusion and access of people living with dementia. The reality is people living with dementia do not currently experience equitable access to care programs and services. They face multiple barriers to participation that can be understood within a social ecological model. As shown here, this model recognizes that access and participation isn't determined only by the individual's abilities, but also by their relationships, by institutions, by their community, and policy. The ability of people living with dementia to participate is not determined by their abilities alone, but how their abilities are supported by family and friends, and whether they have access to programs and services that meet their needs and preferences. Whether the people in their community hold stigma of dementia, or instead understand dementia and are able to meet the needs of people living with dementia in their programs and services. And so when we started the DICE and DREAM projects, after conducting interviews and focus groups with people with dementia, care partners, healthcare providers, and other community service providers, it became clear that there were insufficient dementia-specific health and wellness programs and services to meet the diverse needs and preferences of people living with dementia. A couple specialty programs, even if they're fantastic, programs like the Minds in Motion programs and other programs that are offered in local centers are not sufficient because people have different needs and preferences. So we need more programs and services that are structured to accommodate the needs and preferences of people living with dementia in places close to where they live and where people want to participate. And so our vision at the beginning of these projects was a greater number and quality and variety of physical activity, exercise, healthy eating, mealtime, and wellness programs and services available and accessible to people living with dementia in Canadian communities so that their health and wellness is supported. Our mission started with DICE, which focused on exercise, and expanded to DREAM to target more diverse wellness supports, including those focused on exercise and physical activity, but also those focused on healthy eating, meal times, and beyond. Our primary focus in developing these greater number of opportunities was to increase capacity by training community service providers. When we thought about what would be most effective and feasible to influence the availability of supports and programs, we really thought that improving the understanding of dementia and the capacity of people working in healthcare and in the communities to support people living with dementia would be most effective. People who understood dementia and had strategies could plan programs so that they better met the needs of people living with dementia, and would also have the strategies and confidence needed to accommodate the unique needs of each individual living with dementia in their program. And so that was the foundation for these projects. It's important, as I introduced earlier, though, that we incorporated the voices of people living with dementia throughout, under the concept, nothing about us without us, which is an inherent part of the UN CRPD. We included the voices of people living with dementia at all stages of our project, knowing that their voices, as well as those of healthcare and community service providers, were critical to ensuring that what we developed was relevant, practical, and effective. And so we started with these two distinct projects, but related projects. Until recently, these were two separate sites and separate toolkits that we've now merged into a more holistic dementia wellness website with diverse learning modules, videos, and resources. I'm now going to take the rest of the time, at least the time before the question and answers, to go over a bit about how you can access this website and how you may be able to use it to improve your own ability to support people living with dementia, to live well and be included, and also how you might use it to train others that are under you or in your organization, whether it's students, staffs, or volunteers. First of all, the Dementia Wellness website can easily be found at www.dementiawellness.com. You'll find both the DICE and the DREAM toolkits on a single, easy-to-find site. The makeup of the toolkits is quite similar. They were developed by overlapping teams, so it was expanded within DREAM, and have a somewhat distinct focus. The DICE toolkit focused specifically on exercise specialists versus a broader audience of service providers that would find the DREAM toolkit relevant. All learning modules are free and easily accessible online. Completion is recognized by a certificate, which can be shared with current or potential employers. Indeed, it's also been included as part of academic training and recognized, and is now required, for example, by the Alzheimer Society for their Minds in Motion trainers. You'll find that there's two different sites here to link you through to the learning modules, depending on whether you're an exercise specialist or a broader service providers. It says service providers here, community service providers, but also relevant to people working in healthcare or long-term care. You'll click on the relevant area, and that will take you to the homepage for that group, after which you'll find a link to the training module. By following through on this link, you'll be able to you'll enter the intake page. It'll describe a little bit about the training, who it's for, and the learning outcomes. By clicking on the Get Started button, you'll be able to either enter your existing account or create a new account to support your learning journey. It's important to mention that once you've created an account, you can access both the DICE and the DREAM training through that account. Now, what do the learning modules include? Well, this is our list of 7 broad areas. You'll see in some cases I have exercise versus physical activity more broadly. For those of you who aren't exercise specialists, exercise is just one type of physical activity that's purposely done for fitness gains or functional gains, whereas physical activity might be more inclusive and include things like dance, walking, gardening. The learning modules have 3 core topics. The first is an overarching introduction that will help you understand dementia, the different types of dementia, changes that may occur with dementia, as well as the rights of people living with dementia, and more broad, general inclusive strategies. I would say that these 3 core modules on dementia and the rights and inclusion are relevant well beyond people who are focused on physical activity, healthy eating, and wellness programs. They're really core ideas that would be relevant, I think, and I'm biased, of course, to anyone living in communities that is driven to better support and understand the people living with dementia that may be neighbors, family members, and friends. The other 2 areas of modules focus on the benefits and recommendations related to either exercise or physical activity or healthy eating and meal times. We also offer specific dementia inclusive strategies that are relevant to those settings, whether it's delivering activities in a gym and instructing exercises or running a mealtime program. Here you can see one example of the very first module that you might look like. You enter in and see that overarching lesson with a number of different pages that introduce different types of contents. It starts with the aims of the lessons, goes through the content, finishes with some reflection, and then there's a quiz to end each section of the modules. This is an example of one of the content pages. So here within the core understanding dementia, we have a page that introduces some actions that might suggest that someone has cognitive difficulties and may have dementia. This is, of course, because we know a lot of people with dementia won't disclose their diagnosis to you. So it's useful to recognize when someone might benefit from some of the inclusive practices that we suggest here. Here you can just see an example of the review questions that complete the module. We also have a number of complementary resources that can be used either within programs or can be shared with people living with dementia or care partners. They can also, of course, be accessed directly by people living with dementia, friends or families, or other people who want to support people living with dementia in their communities. By clicking on this resource page, as indicated here, you get taken to the resource site. You can filter what we have. We have many, many resources by the program. That would be Dream or Delight. Or Dream or DICE. You can filter by audience. Is it meant for service providers, exercise professionals, or the general, or people living with dementia and their families, by language and by topic? I want to recognize that the resources are, especially the Dream resources, are available in both English and French, and key resources have also been translated into simplified Chinese, Punjabi, Portuguese, and Arabic. Again, many of these resources are targeted to people living with dementia and their families. They're written in accessible languages and formatted in ways that make them easy to consume. The goal is to give them the knowledge and confidence to live well through physical activity, healthy eating, and eating together. We also include wallet cards, which enable them to share information about themselves, including their goals, preferences, and supports that they might need. This means that they don't have to recall that information at every meeting, but can just share the card ahead by a way of sharing their diagnosis and supports that may be helpful to them. Here I share 2 examples of resources. We collaborated with the Ontario Brain Institute to revise their It's Time to Get Active handout, which talks about the benefits of physical activity for dementia, whether it's reducing risk of dementia or promoting well-being of people living with dementia. It also includes some action planning to help people find ways to become active. The resource on the right is one of our simplified Chinese resources focusing on healthy eating and dementia. Here we share two examples of wallet cards. You can see it gives the person the opportunity to share their name, why they want to participate in this program. So they want to be active because they enjoy foods they enjoy, and what support may be helpful to including them in the program. What we know is that there's no one strategy that's going to be effective at including each individual living with dementia. Each person has different strengths and challenges. So understanding what has been useful to them with their family and friends may be also useful to you in supporting them in programs. Now, I would argue that the videos, including the one that we watched, are likely the most impactful part of the learning modules. You can access, the videos are integrated within the learning modules, but also can be accessed directly. We include 6 separate videos that can also be accessed on YouTube. These include advice for living well with dementia, I have dementia, but I'm still me, to understand how people living with dementia continue to have individual identities and diverse expressions of dementia. Eating together brings me joy with dementia, talking about the benefits of inclusive mealtimes. Healthy eating helps me live well with dementia. Staying active helps me live well with dementia, and dementia-inclusive physical activity or exercise. A little support goes a long way. These videos really align with the core concepts behind the learning modules and are meant to support the destigmatization of dementia by seeing people engage successfully in exercise, eating, and mealtime programs. Again, I'm going to show one. This is a shortened video of the Staying Active Helps Me Live Well with Dementia, and it shares some of the ways that physical activity may improve the well-being of people living with dementia from their perspectives.
And I didn't think I could, use most of the equipment because I've never been an exercise person other than for walking, but I love it.
Some of the benefits that people living with dementia experience with exercise would be improved mood, improved independence, just the ability to feel better day to day.
I feel more energetic and I think I sleep better, and exercise is totally doing me good, 100%.
I had a lady who used a walker every day. After our exercise program, she does not bring that walker with her anywhere. She doesn't need it in the house, she walks independently, and I can only imagine how much independence that has given her.
And when you feel more confident, I think, just in exercise, I feel like that translates outside of the building as well. So hopefully they feel more confident in some other skills, maybe conversing with people, because it is in an environment where you need to connect with others. And then there's a group class, so there's other participants and other caregivers. So that's a really important aspect of that benefit, that they feel, I think, positive about their physical ability, but then also their ability to still interact with people around them.
So it's sort of like, oh gee, life isn't going to be as bad as I thought.
So again, there, I think one of the things that resonates is not only the broad benefits of physical activity, but how much the support of both staff and volunteers. We saw a number of students in that video as well that have worked in programs at the University of Waterloo, really are part of the success and impact of the programs. both because they enable people living with dementia to participate, but also because that support, encouragement, and engagement through programming is so important to living well with dementia as well. Now, most of what I've talked about so far has focused on the content that's focused on service providers, whether they're in the community, in healthcare, or long-term care. We do also have sections that are very specifically designed for people living with dementia and their supporters that relay similar information that's in the modules, but in a more simplified format. Before I go on to show, one example of those parts, I do want to say that the learning modules are, of course, accessible to anyone in the community. You don't have to be a person that's actively delivering services. They're certainly relevant for care partners as well, other family members, and neighbors. I've even trialed them with younger kids. I'd say, my son, who's 9 years old, is probably a little bit young to take in this information, but probably high school students who might be looking to volunteer in long-term care or other care settings in the community might find these really relevant to them as well. But we do have this simplified version, and that might be better both for people living with dementia who may find the modules a little bit more challenging to maneuver depending on their own abilities. And that, in fact, may be more relevant to a larger audience that may have a little bit that can use it as an introduction. In general, in each of these content areas, so you can see on this last slide, we have areas around right and inclusion, physical activity, and healthy eating. Within each of these areas, we have a few subsections. Here I show one. So in general, each of these sections for people living with dementia will share a little bit of text, a paragraph or two about the concept. Here we reinforce their right to participation and inclusion, that they have a right to have program leaders who really support them in these community services. We'll have a video that resonates. Sometimes it's a DICE or DREAM video. Here we share the Alzheimer's Society's video on the Canadian Charter of Rights for people living with dementia. And we also have a key resource that goes along so that there's a number of ways that you can learn about the same message. Now we also have a number of other resources that I haven't mentioned here. First, for those of you doing formal teaching, we do have slide decks that are meant to support teaching where you can incorporate it into classroom or other settings. If you're interested in using these slides, feel free to reach out to myself or the Dementia Wellness team. On the website, we also include high-quality resources from other organizations that are related to physical activity, healthy eating, mealtimes, and dementia. Finally, we also include information about the Delight program. I haven't talked a lot about this here, but this is a co-designed health and wellness program for people living with dementia. We've started implementing it in the community, currently at 6 sites across Canada. If you're interested in delivering a health and wellness program directly designed for people living with dementia and their families, we have the leader manual and resources. Please reach out to us and we can talk more about the program delivery. Now, I hope, through this overview, you have thought a bit about how the DICE and DREAM modules, as well as the resources, might be relevant to your practice. Optimistically, these have already been shared and integrated into education or continuing education in a few settings that I thought worthwhile highlighting. First, it was reviewed by and approved for incorporation into the World Health Organization Global Dementia Observatory, which reviews high quality and shares high quality resources related to dementia across the globe. The Alzheimer's Society of Canada has included the DICE training as a prerequisite for their Minds and Motion training and shares the DREAM training on their website for continuing education. The DICE training is also a continuing education recognized by the Canadian Society of Exercise Physiology and the Ontario Kinesiology Association, while BC Parks and Recreation has included the DREAM training as part of their continuing education. It's also integrated by a number of courses or programs across the country. These are just a few of the organizations that have been using the training programs so far. But importantly, I want to finish with some of the experiences of people who actually went through the training, because I think their words often emphasize the impact and the practical use of the training. So one community service provider said, I thought the training modules were very relevant. Like all the things that we talked about in the different modules was like, I thought I can use these in real life interactions and real life experiences, which is great. Another provider who went through the DICE module said, I will definitely use the resources and modules provided by DICE for future reference. One prime example in which this can be used is whenever I receive students for placements. I feel as though if they were to complete the DICE modules, it will help give them a better understanding of not only what it is like to live with dementia, but also the relationship between exercise, dementia, and how to implement exercise for those living with dementia. Finally, another participant said, well, it was very informational, very educating, and I like that. Like every module was something new for me to learn. I think the videos were really well done. I think that gave more insight into to see what it is really like. I think that's something we heard consistently. The videos are really impactful because you hear from people living with dementia, and sometimes that changes your perspective of dementia from only the end stages to understanding the full breadth of experience to be living with dementia. So just to finish off with some key take-home points, I hope I've convinced you that people living with dementia have a right to equitable support for their health and well-being and inclusion in their communities. And we all have a responsibility to support and accommodate that right. You can find all the learning modules, videos, and resources to support the health, well-being, and inclusion of people living with dementia at www.dementiawellness.com. Again, teaching slides are also available upon request. You'll find website sections targeted to exercise and other community service providers broadly. I say community there, but we've also had healthcare workers do them, as well as within that, people in long-term care. We have another section that's targeted to people living with dementia and their supporters. Again, you may find that, especially as family members or people in the community, either one of these sections may be relevant to you. You can use these learning modules and resources for your own education, as well as that of students, staff, and volunteers, and indeed to support the people living with dementia and care partners in your program. So just last thing before we go to question and answers, I'd just like to say thank you to those groups that have funded us, the Canadian Brain Research Fund, which is a collaboration of the Brain Canada Foundation and the Alzheimer's Society of Canada. Thank you also to the Public Health Agency that supported the DREAM project. Again, the views expressed here do not necessarily represent the Public Health Agency of Canada. And finally, the support for the DREAM project, or the DICE project, that was by the Alzheimer's Society Research Program, the Canadian Institutes of Health Research, the Jobson Family Foundation, the Schlegel-UW Research Institute for Aging, and the University of Waterloo. And with that, I say thank you very much for listening to me, and I really welcome questions and any discussion that you might have. That's always the most valuable part, maybe, of discussion of the webinar. So I'll open it for questions now.
Thank you so much, Laura, for describing the toolkits and why they're valuable for service providers and really walking us through how we can access them. Just as a reminder, we do have a Q&A box at the bottom of your screen. So if you do have a question for Laura, you can put it in there. I have a couple that we can get started with, but as Laura's answering those, if other questions came up, feel free to add them. All right, Laura, the first question is there any research on the effectiveness of virtual programs for clients in rural areas?
That is a great question, Candace. I think, before the pandemic, there was so little virtual programming that we saw, and it's been a really rapid increase. Over the pandemic, I worked with the Minds in Motion with the Alzheimer's Society of Ontario team to create a virtual model of Minds in Motion. This included, people both in urban and rural areas, but indeed, that we saw benefits in, well-being of people living with dementia, feelings of social connection. We're currently also doing an evaluation of the Delight program that I mentioned. The virtual programs, we also saw, improvements in, health behaviors, improvements in physical function in terms of perceived well-being. So I think the information is emerging, certainly to support virtual programming. Not all of it has been rural specific, but I think it's becoming a really valuable model to deliver programming to people who can't get in, whether it's because of rural location or it's because they just don't have transportation and can't get around traffic in urban areas.
Great, thank you, Laura. You mentioned briefly the Delight program as well as the Alzheimer's Society's Minds in Motion program. Can you just explain a little bit how they might differ?
Absolutely. So first thing that I would say is that, the Alzheimer's Society of Ontario and the Alzheimer's Society of Waterloo Wellington were both members of the co-design team. So we kind of had Minds in Motion, and I've also been involved with Minds in Motion since the beginning. So we had that program in mind, and we didn't want to replicate anything. There's some elements that are similar in that, they both have the exercise component, and really the models of exercise in the two are quite similar. Say the biggest difference is in kind of the other component. In Minds in Motion, it's kind of a social recreation, cognitive stimulation. Whereas the Delight program is really built around kind of that quote from Roger, almost the hope for living well and practical strategies to achieve this. So we try to share information and strategies for them to live well with dementia. So we have the fitness, and then there's a shared learning component that's really built around a resource, but where we encourage people to share their own stories. And the topics within that shared learning part are healthy eating, physical activity, sleep quality, mental well-being, and social connection and supports. So we talk about how each of these elements supports living well and strategies that can improve the outcomes. I did see Lloyd Schneider, I think, was on the participant list. He's actually one of our members of our Delight research team, and was involved since the beginning. So it's a little bit different. I know our local society has been thinking of people would start with Delight and then they might graduate to Minds in Motion, where they really start with, these core strategies. Other places are offering it if they don't have the Minds in Motion program, or because Minds in Motion is, an Alzheimer's Society specific program, Delight is more flexible. It can be offered by a number of different organizations. And we know there's some communities that just don't have an Alzheimer's Society branch.
Great. Those were the couple questions that came in. I had one more that others might be interested, but just to give people a sense of how long it might take to complete the modules, do you have any sense of what previous participants have said?
Yeah, so a little bit. So I would say that the DICE training is probably, 2 to 4 hours of training, whereas the DREAM training is probably, 4 to 6 hours. People can get, to some extent, it depends how quick you read and whatnot, and but they can be done, one subcomponent at a time. You don't have to do it all at in one sitting. You can do them on the phone. So if you're commuting on a train, you can use that. I would say, I'm having the upper end. If anything, the DICE can probably be done in 2 to 3 hours. But yeah, I would say those are the best, kind of the upper end estimates for the amount of training.
you. And I think maybe one more thing to mention would be about the certificates at the end. That might be interesting for some people.
Absolutely. So at the end of both of these, you get a certificate of completion, either the DICE or the DREAM, depending of what you're completing. And you can, share these forward. I think they're increasingly being recognized on, resumes, and they're great for students as, dementia-related training. As I mentioned briefly, Minds in Motion exercise trainers, now have to have the DICE certificate, but it does demonstrate that you've kind of gone through and thought about dementia and its inclusion. One thing that I think it was interesting too from a student perspective is perhaps not surprising, I share some of this training with our undergraduate students in kinesiology and health sciences at the University of Waterloo. And they described it as one of the most impactful and useful elements of their learning when they went out on co-op experiences. We have a lot of students who work in long-term care or day programs or other programs where they might interact with people living with dementia. So this, this knowledge was really useful to them.
Yeah, for sure. And one more question came in that is, do I have to finish the training in one go, or can I do it in a section?
Yeah, so no, you can do it in as many sections as you want. You can go away and it'll track your progress and come back to it. So it's meant to be quite flexible in that way. We knew that, people especially, are quite busy, so you can do it in as many segments as you'd like.
Wonderful. Well, we are coming towards the end of our time, so I think I will launch the poll, but if you do have any last minute questions that come up, feel free to still enter those and we can respond to them while people are completing the poll. Oh, another good question that just came in, Laura. Do I need to pay for the certificate?
No, so all the learning modules are free and accessible online. You'll get the certificate once you've completed all the content and the quizzes. The last thing you do, the last kind of module within the learning modules or part is getting your certificate. So all of that is free. Really, it's part of an initiative where we really want to see the capacity of people to accommodate people living with dementia is expanded. And so we've worked to keep these learning and their certificates free to access. If you do, yeah, if you do have any more questions or different contexts, I welcome anyone to reach out to me as well with questions. My email's laura.middleton@uwaterloo.ca.
Wonderful. We will leave the webinar open for a few more minutes as people are completing the poll for us, but I want to once again thank you, Laura, for sharing a wealth of information today about the Dementia Wellness website and everything that's been included into that. And thank everyone for joining today. It was wonderful to have you, and I hope that this has been valuable and you find a way to incorporate what you've learned today into your practices, whether that's at work or in your personal life as well.
Yeah. Absolutely. Thank you so much, everyone, for giving your time. Hopefully it can be useful to you.